Hello, my name is John Medalle. I'll be talking about NeuroMind, an application intended for neurology purposes, and it is basically intended for neurosurgeons, neurologists, and some nurses practicing on the neuro floor. So it provides interactive clinical decision support and over 120 clinical classifications and some grading systems along with some anatomical diagrams. And it is basically supported officially by the Surgical Neurology International and the European Associations of Neurosurgical Societies. So what about NeuroMind? Yeah, it's again can be downloaded from your iPhone, iPad, Android, tablet, and PC. And it is being published by the digitalneurosurgeon.com. So it's a good reference manual again for neurosurgeons and healthcare personnel of the neuro field. So the founder or developer of the application is Dr. Peter Kuben. So he's a neurosurgeon from the Maastricht University Medical Center in the Netherlands. So also he's the associate editor-in-chief and informational technology editor at the Surgical Technology International. So this is actually when you try to go into the app, this is the first level that you can see. So as you can pretty much visualize, you have the coma, infection, and also you have the anatomy portion of it. So to go deeper, you have to tap into the next level. This is one example of the scoring system that they have. This highlights the cerebral infarction after a stroke. So this is pretty much a nice tool if you're working in a stroke unit. So to assess your patients better, so you have to plug in the information and the data, and then you can assess or you can base your plan of care from this information. So also there's another look at the second level of it. So as you can see again, the Glasgow Coma Scale is there. It's very important. We know that from the neurological point of view, it's a good tool to assess the patients in a stroke, and also with RAS, Enrichment, Agitation, Sedation scales there. So usability in terms of layout, intuitiveness, and ease of learning. So it's simple and logical. Again, as I mentioned, it has 3 levels. It's very accessible, intuitive, and it's clear and understandable. In terms of utility, again, this app is basically useful for stroke unit nurses or pretty much neurosurgeons, and or some higher level management or nursing education. So it can be again pretty much used on the same field like neurology unit, post-op, some applications to medical, surgical, and cardiac units, because some cardiac units have stroke related patients too. So and pretty much is for neurosurgery. Simple advantages is again is straightforward reference organization and excellent graphics for anatomy, as you can see there. You can pretty much see it. And some disadvantages is diagnostics, it's pretty much on a neurology side. Basic reference manual, needs reference to additional database for details. And on terms of ethics and legal aspects, this app is a general reference without interpretation criterion. And does not reference for further detail of specifics. So it's kind of like superficial, but again, it's very, it's a handy equipment. So site privacy statement states it does not collect any personal information. And for my conclusion and recommendation, again, it is a good basic reference for quick access for neurology-related pathophysiology, diagnostic scale, and anatomy. And it can be used as a quick summary of information. If you need to have a scoring system at hand, and then you have a patient having a stroke, so you can pretty much use this application. And the only limitation it has, again, it's into the details, so it doesn't really give you an in-depth analysis and decision making regarding the pathophysiology of the disease. And that sums it up for my presentation. And thank you very much.